Great highlights from this ASCO, and I will key in on some of my favorites that are in melanoma, but as you know, melanoma is the gateway to other solid tumors. Paulo Ascierto presented data from Relativity-048. What is Relativity-048? It's Ipi, Nivo, and Relatlimab, a triplet checkpoint inhibitor, which showed unmistakable benefit and progression-free survivals. So that's a backbone that we're doing in trials, and we're adding IL-6 inhibitor, so a quadruplet. I think that that's unbelievable and amazing, and is moving that to other solid tumors. LAG-3 expression is in many different solid tumors. So that I liked. Of course, you cannot come to ASCO 2024 and not talk about NADINA. And I like it. We were the only US site to contribute to NADINA, but NADINA was a neoadjuvant versus adjuvant where we gave 2 cycles of neoadjuvant, flipped dose Ipi-Nivo versus just giving adjuvant anti-PD-1 alone. And what we saw was the event-free survival was so much better. It's like 87 versus 50%. The other thing we saw is something that we have been talking about for a long time. That is, can we decrease the intensity of therapy? And on NADINA, in those proportion of patients who are on the neoadjuvant regimen of flip dose anti-CTLA-4, anti-PD-1, 60% had a path complete response. And the event-free survival, that means the proportion that never had relapse, was 97%. Why is that important? Because the trial said, if you have a path complete response after those 2 doses, stop, no more treatment. What are we doing? We're decreasing the amount of drug, the cost of therapy, the amount of time our infusion centers are tied up, and most importantly, the risk of immune toxicity for our patients. And this is going to set a paradigm for all solid tumors doing neoadjuvant work. But there's so much more. Jeff Weber updated 3-year data on the Moderna vaccine in the adjuvant with continued benefit in progression-free survival, and what I think is the most important, distant metastases-free survival. And as you know, there's a major randomized 3 trial from that combination that is almost fully accrued, so we'll know about that soon. I will step aside from cutaneous melanoma and say great data that is opening the door to therapy for uveal melanoma. Uveal melanoma patients look at this and they go, they'll never talk about me. But there was the IDEA drug in neoadjuvant to treatment for a primary ocular melanoma, showing that you can preserve vision in 70% of patients with large tumors, decrease the rate of giving radiation, the area you give radiation to. There was the adjuvant trial that was presented with flip dose Ipi-Nivo, which was a small trial, but indications of a possible benefit for high-risk patients receiving checkpoint inhibitor in the adjuvant setting. So there's a lot at ASCO, and these are not just melanoma trials. They are setting the standards for how we design trials for all solid tumors, the endpoints that we're going to be looking at, how to use those as prediction for recurrence-free and overall survival, and how to move and add more to regimens where we thought we were done with combination, triplets, quadruplets, etc.